Good day everyone, my name is Juan Miguel Oapat and today I am going to perform assessment of musculoskeletal system. For the equipment, we are going to use percussion hammer. Assessment, procedure number 1, assess the client's physical and psychological aspect before and during the examination. Rationale, allow healthcare provider to gather complete data about the client's health status. So good day ma'am, ako nga pala yung nurse niyo po ngayon ma'am. May ano po yung name niyo po ma'am? Thank you po. Next, procedure number 2, review body areas to be examined. Rationale, health examiner, healthcare provider identify which part of the body is to examine systematically. Procedure number 3, for planning, make a physical environmental preparation before examination. Rationale, proper preparation of environment, client and equipment ensures smooth physical examination with few interruptions. Procedure number 4, determine and prepare materials, equipments needed. Rationale, to have a comparison with previous illnesses and present health condition. For the implementation, procedure number 5, identify the client. Rationale, to assess, determine, and identify abnormal findings in the body system. So, ma'am, may ano kung ano pang name niyo po, ma'am? Thank you. Next, procedure number 6, explain the procedure to the client. Rationale, explaining the procedure to be done reduces anxiety. So, ma'am, ngayon po, ma'am, mag-assess po tayo ng ano niyo po, ma'am. Musculoskeletal niyo po yung mga reflexes niyo po, ma'am. Okay na po ba?
Okay.
Thank you. Next, procedure number 7. Properly position the client. Rationale, proper positioning ensures easy access to the body parts to be assessed and clients feels comfortable. So, yan na po mga straight na po ang likod mo. Comfortable mo ba kayo?
Yes.
Thank you. Next, procedure number 8. Take the health history of the client. Rationale, talk of comparison from previous illnesses and present health condition. So, mag-assess po tayo ng ano niyo po ma'am, mga reflexes po sa katawan ma'am. Meron po ba kayo nararamdaman ng mga sakit sa ano po ma'am, sa likod or sa muscles niyo po sa iba't ibang parts ng katawan ma'am?
Wala.
Wala naman super. Thank you. Next, procedure number 9. Conduct physical examination using force skill in physical assessment. And for the rationale, to assess, determine, identify abnormal findings in the body system. Now, for procedure number 10. Inspect the muscle for size. Compare the muscle on one side of the body to the same muscle on the other side. For any discrepancies, measures the muscle with a tape. And for the rationale or the normal findings, equal in size both sides of the body. So, i-inspect lang po natin yung ano po nyo. Next, procedure number 11. Inspect the muscles and tendons for contractures. And for the rationale or the normal findings, it should be no swelling and no contractures. Next, procedure number 12. Inspect the muscle for tremors. For example, having the client hold arms out in front of the body. And for the rationale or normal findings, it should be no tremors. So ma'am, ano lang po natin yung ano nyo po, inay po ma'am. Kailangan po natin. Salamat. Now for procedure number 13. We are going to test muscle strength. Compare the right side to the left side. First is sternocleidomastoid. Client turns the head on one side against the resistance of your hands. Repeat with other side. So, i-ano lang natin, mama. Doon ka po mag-ano, ma'am. Resistance po, ma'am. Kabila na po, ma'am. Thank you. Next procedure, for trapezius. Client shrugs the shoulder against the resistance of your hands. So, i-resist niyo po yung kamay niyo po. Sige po. Thank you. Next, for the deltoid. Client holds arm up and resists while you try to push it down. So, sa dito na po mga ganun. I-alam na po mga. Kabila. Okay, thank you. Next, for the biceps. Client fully extends each arm and tries to flex it while you attempt to hold arm in extension. For the normal findings, equal strength on each or both sides. Okay, next for the triceps, clients flexes each arm and then tries to extend it against your attempt to keep arm in flexion. Now for the wrist and fingers muscle. Client spread the fingers and resist as you attempt to push fingers together. For the normal findings, equal strength on each body side, each on body sides. Okay, next for the grip strength. Client grasp your index and middle fingers while you try to pull the fingers out. And for the rationale, equal strength on each body side. So, ano lang po ni ma'am, hawakan niyo po yung ma'am. Diba? Kabila po. Okay, next for hip muscles. Client in supine, both legs extended. Client raises one leg at one time while you attempt to hold it down. And for the normal findings, it should be equal strength on each body side. So maghiga po tayo ma'am. Kabila. Next, for hip abduction. Client in supine, both legs extended. Place your hands on the lateral surface of each knee. Client spread the legs apart against your resistance. And for the normal findings or the rationale, it should be equal strength on each body side. Yan lang po na dito. Thank you. Now for hip adduction. Client as in same position as for hip adduction. Place your hands between the knees. Client brings the legs together against your resistance. And for the normal findings or the rationale, it should be equal strength on each body side. Next, for the hamstrings. Client in supine, both knees bent. Client resists while you attempt to strengthen the legs. And for the normal findings or the rationale, it should be equal strength on each body sides. So straight lang po atin yun, ma'am. Okay, next for the quadriceps. Client in supine, knee partially extended. Client resists while you attempt to flex the knees. And for the rationale or normal findings, equals strength on both sides. Next, for muscle of the ankle and feet. Clients resist while you attempt to dorsiflex the foot, again resist while you attempt to reflex the foot. And for the rationale or normal findings, it should be equal strength on both sides. Now, procedure number 14. Inspect the skeleton for structure. Rationale or the normal findings, there should be no deformities. Next, procedure number 15. Palpate the bones to locate any areas of edema and tenderness. And for the normal findings or the rationale, no tenderness or swelling. Next, procedure number 16. Inspect and palpate joints for tenderness, smoothness of movement, swelling, crepitation, and presence of nodules. And for the rationale or normal findings, no swelling, tenderness, and no nodules. Now, procedure number 17. Palpate the bones to locate any areas of edema or tenderness. And for the normal findings or rationale, no swelling and tenderness. Now, for the neurological reflexes. Procedure number 18. Bicep reflex. The patient's elbow is slightly bent forward while your arm is supporting the patient's arm. By placing your forearm diagonally underneath the patient's arm, strike the bicep tendons with or using the percussion hammer. And for the normal findings or rationale, the contraction of the biceps can be seen and felt. So dito po tayo po, ma'am. Next, for the tricep reflex. The patient elbow is lifted and bent while And while hanging freely, bend with your hand supporting the patient's arm by holding the distal humerus. Strike the tricep tendons one thumb from the body prominence of the elbow using the percussion hammer. For the rationale or normal findings, the contraction of the tricep can be seen as elbow extends. Now, procedure number 20. For knee, the patient is in the sitting position. The patella is struck with the percussion hammer. If the patient is lying down, the reflex is tested while the examiner's hands are placed under the knees to bend them. And for the rationale or normal findings, the contraction of the quadriceps causes the knee to extend. Next, procedure number 21 for ankle. The leg is bent at the knee and the foot is supported in bowling position. The Achilles tendon is struck with the percussion hammer. For the normal findings or rationale, the foot jerks and moves downward. Okay, next for the plantar or Babinski reflex. The lateral aspect of the sole of the foot is stroke with an object. Then the stroke at the lateral border of the sole of the client's foot, starting at the heel and continuing to the ball of the foot, and then proceeding across the ball of the foot towards the big toe. And for the normal findings or rationale, the toes bend and or curl. Yan ang ating problem. Wala pa. So now, procedure number 23, reposition the client. For the rationale, to ensure that the client is comfort. So ano pong ano niyo po, comfortable sitting or mahiga na lang po? Higa.
Paghiga.
Now, for the evaluation, procedure number 24. Make findings of health assessment and physical examination done on the client. Rationale, these are important data to convey that physician aid in diagnosis of the patient. And for the documentation, procedure number 25. Record, document, or report any pertinent findings found during the assessment to appropriate personnel. Rationale, to provide accurate data in the care of the client. So, musta po ang assessment po ngayon, ma'am? Okay lang po ba or meron kayo nararamdaman na sakit-sakit sa ano po, ma'am?
Okay.
So, okay. So, based po dun sa muscle strength and sa reflexes niyo po, ma'am, na-perform niyo po siya ng maayos, ma'am. Okay lang po lahat, ma'am. Normal lang po siya sa sa lahat, ma'am.
Okay.
So, thank you po, ma'am. So now, we are done on assessing the musculoskeletal system. Thank you for watching.